Hello everyone, this is Dr. Swapnil Chandratre here. Many of the students have asked me this thing, that is the German patients or is the clinic staff or does the boss, do they accept us Indian as a dentist there? How is the approach of the patient towards the dentist? Do they accept us or they just do racism? And how is the work culture here in Germany? Today I am going to explain you all those things in detail. If you haven't subscribed to the channel, please subscribe to it because such information you are not going to find anywhere. To answer that question, that whether we are accepted as a dentist in Germany, there is no clear-cut answer of yes and no. It is a little bit complex answer than just a simple yes or no. I'll explain you based on my personal journey and the journey of all other dentists who are coming here and working here. Then I'll give my inputs and my suggestion that what you can do and how to improve all those stuff. Let's start step by step. First stage of your journey is when you have started working in some clinic, or you have started doing the hospitation before your FSP, you are in the clinic for the first time to some clinic, then what is the scenario there? As a dentist who has already been working in country or running their own clinic or working somewhere in some clinics, so those might be the different for the every individual. But when you join in the clinic here also, whatever the treatments that is being done in India, that will remain almost the same. You will understand everything what is happening in the clinic in terms of treatment. For example, filling, extraction, implants, crown preparation, endo, whatever is happening, you understand that the doctor is doing this thing. This is the diagnosis. That is the way it will remain the same everywhere in the world. In that scenario, you won't be too much of confused. The confusion part will come in the beginning in terms of the system. Here, as I said, everything is based on the insurance. Money is mostly paid by the insurance. In every clinic, there will be the computer software in every room. Most of the modern clinics, they do it everything digitally. Some old clinics do that manually, that they write down everything, the documentation part once the patient is gone. They first write down in a rough paper and in the end some assistant will write it in digital form. Or in modern, all the clinics, they do it in the beginning very digitally. In every room, mostly there will be the computer. There is one software for this insurance thing. Breaston, I would say, they give all the positions based on whatever they are doing, and in the end they'll write the entire documentation from beginning till end. What has doctor advised, what has doctor done, and what is recommended and all that stuff. In the beginning, you will need a lot of time to understand that what is happening. You will be in a little bit of a confused mode. When you are doing the hospitation, you will be moving around with the doctor, the boss or any other doctor who is working there. You are observing that what is happening. Let's talk in the patient perspective. When patients see you like that now you are looking, you are talking, the doctor is explaining to you that I am doing this thing, that thing. Same, you can compare that thing to India. If any dentist who has one assistant dentist in the clinic, or if you have worked as an assistant dentist in some clinic, in the beginning it will be also like that. The doctor is just like a teacher to you. He or she will explain you that how these things are working. You are listening and learning. In terms of patient's point of view, you are a student or a beginner, or they're not that much of an experienced person. They don't know. You might have 10 years experience, you are MDS or whatever it is. For them, you are just a normal student who is learning the system, who is learning the process, and they will see you as a student or a beginner. If that boss is giving you any treatment to do, now I have seen this checkup, this patient requires this filling, can you do that filling? I am going to check another patient. For example, if such scenario, or you remove this teeth, it is like that, or you do endo in this thing or something like that. Such kind of a scenario when happens, then that patient is little bit in the beginning skeptical to you. I would say this will remain same everywhere. It is not dependent in the country. We have this kind of tendency that if it is happening in any other country, then we'll take it as a racism, that people are not accepting it. But this kind of thing is happening everywhere. In your home country, you can also relate to it. That in our clinic also, when any VIP patient or any relative patient or any special patient who has been with that doctor since long, who is accustomed with that doctor, they will not allow you to treat, or they will not like to be treated by assistant dentist or any associate dentist. That is the same thing here. It is not a racism, I would say. It's called as a normal human nature. In India, you will feel it little bit less. Here, you will feel it little bit more. Why? Because first thing is that here there is a culture of family dentisting. Once the patient are here, they are most of the time they'll stay with you for a long time. So many patients of the boss will be like since so many years, based on how old that doctor is and how good that doctor is. The patient remains there for many years and they are accustomed with that doctor only. When they see you as somebody new, and also from the different skin color. They don't know you and they don't know how good you are working. Then it is more about not the racism, but more about the anxiousness that whether you will be able to do a good process or not. And in the beginning, yeah, you will face this thing and you need to be ready for it. No one in the world will accept you with the open arm. The respect and the trust, you need to earn it. Now let's go a little bit further. You are staying with the same clinic for a long time. As I said, this patient comes for the regular checkup. Here, normally the patient comes twice in a year, which is been paid by the insurance, or in some clinics once in a year or something like that. When they come again and they see again the same face, when they see, then slowly their mind, that thing has been added. There is another dentist there. There is a possibility that I might get the treatment done from that dentist also. If that patient has got any treatment done by you and you have done it very nicely, you are very friendly, all that thing, then they will, next time when they come for you, they have less amount of anxiousness. They expect in their mind that this is the doctor will be there, this is the dentist under whom I will be getting treated. In that scenario, they are more open to you, they will be more acceptable to you, they will see you at a less skeptical eye. Slowly, third time, fourth time, when that patient comes, then by that time they will accept you, they will have the trust, they will begin to trust you. This is the phase with every dentist is going to pass through. It doesn't matter if you are a BDS, if you are MDS, if you have 10 years experience, if you have 1 year experience. This thing you need to be mentally ready to face. During that time, if you don't let your ego go, if you are too much of uptight person, not friendly person, not that kind of smiling person, good nature person, it takes you more time to get accustomed. The things will change when you are done with your KP. When you are done with your KP, if you are working in a good clinics, those clinics who have so many new patients, in that clinics, boss will start giving you patients on your own name. When the new patient comes, since beginning you start treating them, then this patient will be your patient, not your boss patient. That patient has seen you since beginning. They are not the boss's patient since a year. It will be the new patient for the new face for them. In that scenario, your acceptance level is near to 100%. Because for them, it doesn't matter who treats you, right? They doesn't know who your boss is, who you are. For them, you are a dentist. In that scenario, you are responsible for that patient. That is your patient. There, your acceptance level is mostly 100%. Of course, they will compare you with their old dentist. They need to accept that fact. They have left that dentist, or that dentist has gone to retirement, and they don't have any choice than to coming to you. Every dentist has their own way to treat the patient and own diagnosis and own methods. The method will change. They accept that. They know this person is different. So of course, opinions will be different. They will accept that thing. If you stay in a one clinic, now this is the very important point. This thing will only applicable to those people who remains and stay in the same clinic for a long time. If you work in some clinic for 1 year, then you shift to the another clinic for another 1 year, then you shift to another clinic for 2 years. If you are doing that kind of stuff, then you need to keep in mind that whenever and wherever you start another place, from that place you need to start from scratch. You will face this thing again since beginning. You are more experienced by then in understanding the system. In that scenario, you will get accustomed faster. In terms of skepticality and all that thing, you might feel again also when you change your job. By that time, you are mentally ready for those stuff. But again, if you are working in the same clinic for a longer duration, then the acceptance phase is more faster. It is better. My suggestion is to avoid that thing for a long term better acceptance. If you get the offer from a very good clinic, a big clinic where multiple doctors are working, the clinics they have good modern technologies and all that stuff. In those clinics, you have a maximum chance of growth. Don't let go of such kind of job offers. Since beginning, if you find this kind of job, then do whatever you want, but stay there. In terms of earning is also good. Growth potential is also maximized. I am just talking based on my personal experience and experience of other dentists who have been here and successful. These are the things you need to keep in mind in terms of patient. Now coming to the second part is what about the clinic staff? What about our boss's nature and the staff behavior? Do they accept us in their culture or not? Again, in that scenario, see in the beginning, if you have worked in India, in the clinics, or if you had your own clinic, you have been worked as a boss or something like that. In that scenario, this is the very important thing you need to understand, that here the dental assistant who are working with us, those are also very learned and also trained person. They also study here 3 years for this thing before they can work as an assistant. Some do the masters also for 1 or 2 years more, they have also all of the knowledge of the dentistry. Of course, they cannot perform all the treatment, but they also know the theory. They are also learned person. Most of the time, these assistants are for the years with this doctor. They are very senior sometimes. They know more stuff compared to you in Germany. Most of the time, you learn a lot of stuff more from this assistant compared what you learn from the doctor. The doctor can teach you about the system and all that thing, but the day-to-day work and the documentation and all that thing, you can learn a lot from the assistant, because most of the time this documentation work is being done by the assistant in the room only. The doctor will only treat the patient and move away and go to the another patient, and after that all of the stuff has been done by assistant in most of the clinics, especially in the bigger clinics. In that scenario, here the German culture is straightforward. You might face some assistant, they might tell you that no, this thing you are doing wrong, you should do like this is the way to do it and all that thing. But our Indian mind is, if we stick to our stuff, if we compare it with our assistant in our country, what they know, I am the doctor, I know more than them, I'll not hear to them. If you are stuck with that kind of attitude, people will not respect you. Respect has been earned, ego has been earned, trust can be earned. You cannot throw those things on someone. You have to respect me. It is not the way it will work. These people are very learned, proud and friendly people. If you accept, if you are open-minded, if you are friendly, if you accept this, all of the things, everyone will accept you with the open arm. Trust will automatically build up. It's not like that assistant will gonna tell you that now you do this, now you do that. In terms of opinion, you can also take their opinion. Later on, you understand and learn all the system. You build your own patient basis, so build your own trust and respect and all that thing. It will automatically, the respect has been earned. The people are very friendly if you accept their culture. If you are friendly, if you are open-minded, if you are a laughing personality, not so much of stressful or that kind of angry personality, not too much egoistic personality, they will accept you anyway. I would say that everyone will be going to face this thing. It will be totally new for you, this work culture. If you adapt to it, I will say that it's very much fun. I am living a very good life here. We go, to picnics together. We go outflow together and all those things we also do in our clinics. We do partying together. It's very friendly and open culture if you are ready to accept this thing. So my suggestion is that be ready for this thing. Keep your ego and attitude aside. Earn your respect and trust. Your life will be good. I hope that I have answered all the questions regarding the acceptance. If you have more questions and queries that how to execute the process, what is the best way to come here, what to do, what not to do, you can always contact me. The link is in the description box. Till then, have a nice day.